Hi there, I'm Tanya Morrow and I am doing my physical exam on my husband Nathan Morrow with the respiratory, cardiovascular, and peripheral vascular systems. So start with just his general appearance. He's at rest, no respiratory distress noted, his color is good, he's not using any accessory muscles to breathe. Respiratory rate is within normal limits, 12 to 20. So I'll have him turn to the side so we can take a look at his back, and it's kind of hard for the camera to see, but I'll assess for any tactile fremitus and crepitus first, so just any accumulation of air underneath the skin. Any tenderness to touch, Nathan?
Nope.
So I'll have you take a deep breath with my hands positioned. You won't really be able to see. I'm going to position my thumbs at the base of his back and about, I'll tell you when. And then I'll spread my fingers and kind of grip the sides of his body. And I'll have him take a deep breath, and ideally my hands will separate and then come back together. So I'll have you take a nice deep breath, Nathan. You can sit up nice and tall. Good. Perfect. Excellent. And this time you'll feel my hands on you, and each time I touch, I'll have you say the word 99. And I'm just going to feel for the vibration. Ideally, it'll be stronger at the top and less strong at the bases. So at the apices will be strongest, bases will be weaker.
99, 99, 99, 99, 99, 99.
Excellent. So I could feel the vibrations throughout, but it was much stronger at the top and stronger at the apices to the bases. So I will auscultate 14 lung fields. I don't want you to get short of breath, so I'm going to start at the top and I'll go from side to side so I can compare the two sides and then continue down to the bases. And I'll be using the diaphragm of my stethoscope to do that. So hopefully I'll hear some lung fields at the top, nice and clear. So I'll have you take a nice deep breath in through your mouth. Good. Good. And here you can just pretend so you don't get out of breath. And I'll continue down, listening on both sides into the bases. And then I'll continue to do that on the anterior aspect of his body. We'll hold off on that for now. And I'll have you turn and face the camera again. So here we'll just do a quick overview of the cardiovascular. So when you're assessing for areas of the heart, we're going to look for the clavicle, and that'll be the first intercostal space because the rib is up underneath the clavicle. So for the aortic, I'll listen to the second intercostal space. Pulmonic to the left side of the sternum. Aortic will be on the right side. And then down to the third intercostal space will be Erb's point. Fourth will be the tricuspid valve. And mid-clavicular at the fifth intercostal space will be the mitral, and ideally the point of maximum intensity. So then I'm just going to place the pad of my hand over those points and feel for any turbulent flow or any murmurs. So continuing. And ideally you won't feel anything, or maybe just a light heartbeat. And that feels fine. So then I will auscultate using the diaphragm and then the bell, so listening for deep and then high-pitched noise. And ideally, with the love dubs, you'll hear S2 louder in the atria, and then S1 louder in the ventricles. Excellent. I don't hear any murmurs. Good, thank you. So Nathan, I'll just have you lean forward further onto your knees, and I'm going to listen to the aortic and pulmonic valves again. Good. No signs of any deviation there. And then I'll feel for your pulses. So we'll start at the top. I'm just going to feel for your temporal on each side, which we've done already with the assessment of the head. And your carotid. We'll do one side at a time for the carotid assessment. And so far they're all +2. And I'll feel for your brachial, and it's a little easier if we extend that joint. Excellent. Good. And the popliteal, a little harder to palpate. Good. And I would do the same on the other side, and then feel down for the dorsalis pedis. And the posterior tibialis. Good. All pulses are +2. Thank you.